Starting now.
Hello, I'm Dr. Karen Lewis. I'm the medical director for the Arizona Immunization Program Office of the Arizona Department of Health Services. I'd like to talk to you today about hepatitis B virus serologies and the clinical scenarios that go along with them. This is a picture of the hepatitis B virus under an electron microscope. You can see large round bodies that are actually the virus, but there's a lot of other small spherical and longer filamentous bodies. The large round bodies are the hepatitis B virus with their capsule. The additional bodies are the extra capsular material of the virus. And they all are the filamentous and the spherical are extra hepatitis B surface antigen. The virus itself has a capsule, but you have a lot of extra hepatitis B surface antigen. And that is actually the antigen that is tested for to see if somebody is contagious. So these are schematic pictures for the next two slides. And the antigens are, again, hepatitis B surface antigen, a filamentous in a spherical form. And then the virus itself, you have a capsule with the surface antigen. And then also the nucleocapsid, but further in are hepatitis C antigen. And the furthest most in hepatitis E antigen. The C antigen is what they call the hepatitis B core antigen. And the E antigen is what is elevated when there's a lot of viral replication, high levels of hepatitis B virus. But you can be infected and not be E antigen positive. Core antigen is present when you have active infection, as well as the surface antigen. Next slide. Oops, I get to do the next slide. Sorry. The body forms antibodies to these antigens. So the anti-hepatitis B surface antigen, antibody to hepatitis C antigen, and antibody to hepatitis E antigen. So all of a sudden you've got 6 different combinations of letters. So I'm going to try to show you how you can make sense of this. When you first get infected with hepatitis B, the virus is replicating, so you get a lot of hepatitis B surface antigen. And that's the red line going up. And also the hepatitis E antigen, as I mentioned. And then as the body clears the infection, the hepatitis B surface antigen goes away, and the hepatitis E antigen goes away. And at first you form antibodies against hepatitis C antigen, and that's the yellow line is IgM antibody against hepatitis C antigen, and the blue line is the total antibodies against the core antigen, and the total combines both IgM and IgG. And over time, you get antibodies to hepatitis E antigen, but it takes longer to form antibodies to hepatitis B surface antigen. So the definition of an acute hepatitis B infection is you have infection, but you can tell you've cleared the infection when you are no longer hepatitis B surface antigen positive. But it takes another 4 to 8 weeks for you to have detectable antibody to hepatitis B surface antigen. And so in that interval, it's described as a window that you can only tell that there's been an infection, an acute infection, by detecting the IgM antibody to hepatitis B core, and that you can only tell that there's been an infection in the past or present, but there's been an infection with hepatitis B by having hepatitis B core antibody. Once you're infected with hepatitis B, you always have antibody to core, and then but you do not always form antibody to hepatitis B surface antigen. When does that happen? With chronic infection. And this shows the antibody progression to chronic hepatitis B virus infection. You have a surge in the surface antigen, but the body never clears the infection. And so you have continual production, viral replication, and formation of hepatitis B surface antigen. If the viral titer is high enough, you also have hepatitis B e antigen, but that doesn't always show positive. But by definition, if someone is positive for hepatitis B surface antigen, if it's not a false positive, but hepatitis B surface antigen indicates that a person has active viral replication and is therefore infectious. If the hepatitis B surface antigen persists beyond 6 months, that's by definition a chronic hepatitis B virus infection. The antibody to core antigen, you have the IgM that comes up, and that goes away with time, usually by 6 to 9 months. But the antibody to hepatitis B core antigen persists. And just once you have once you have antibody to hepatitis B core antigen, that means at some time past or present, you have been infected with hepatitis B. Sometimes with hepatitis B chronic infection, you can switch from E antigen positive to antibody hepatitis B E antigen. But for just routine care of patients, forget about E antigen. Just know it's positive when it's high. If it's negative, that doesn't mean that the patient isn't infected. Okay. Now I want to go through a variety of different clinical scenarios and initially show you perinatal infection, but also go through people who just have hepatitis B infection or are immune, so that you can practice your skills in understanding the different tests. Just to give you some background on perinatal infections, studies have shown that if mothers have very high viral loads, they're more likely to infect their children at birth. So mothers have either acute or chronic infection. Often it's chronic, but either acute or chronic infection. If they're both surface antigen positive and E antigen positive, the child's risk of developing chronic hepatitis B is 70 to 90%. If the mother does not test positive for e antigen, just surface antigen positive, the child can still get infected, but the risk is lower, 5 to 20%. But we still treat all children born to moms who are hepatitis B positive as having been exposed and needing to be protected as quickly as possible. Perinatal post-exposure prophylaxis is very helpful. Combining hepatitis B immune globulin and hepatitis B vaccine given within 12 hours of birth, followed by the child finishing the hepatitis B vaccine series, 2 more doses, the first one at 1 month or 1 to 2 months, and the second one at 6 months. 85 to 95% of hepatitis B infections are prevented. Not all infections are prevented, and so we test afterwards to see if the child became immune or cleared the infection. Became immune or does not have protection against infection. If the mother is antigen positive, but the child did not get the HBig, the hepatitis B immune globulin, but just got the vaccine, and then you vaccinate, a little lower prevention of hepatitis B, but again, gives pretty good protection. So that is why even when the mom is not known to be hepatitis B positive, you want to go ahead and give hepatitis B vaccine as soon after birth as possible, just to give extra protection to the infant. Of interest, when a mother is hepatitis B antigen positive, quote unquote infectious, and the child for some reason does not get HBig or vaccine, and by testing, serology shows the child was not perinatally infected, but continues to live with someone, at least one person, who is hepatitis B surface antigen positive, they have a pretty high risk of developing hepatitis B virus infection by 5 years of age. Now, there are some caveats with any clinical testing. Every once in a while, a hepatitis B surface antigen could be a false positive. And so laboratories do a confirmatory test if that turns out positive. I'd mentioned e antigen being high with the active hepatitis B replication. The anti-hepatitis B e antigen reflects lower viral levels. There is also a PCR done for quantitative measuring of the virus. That should not be used for just basic screening purposes, because it has a lower limit cutoff. And I've seen a situation where it says not detected, but under the text says there is virus present but can't be quantified. And the healthcare provider read that too quickly and unfortunately did not give the child HBig and hepatitis B vaccine as quickly as should have been done. Hepatitis B vaccines utilize recombinant technology. Virus has a section of DNA that codes for hepatitis B surface antigen. And so that DNA sequence is coupled with yeast DNA. It just sliced in there. And so when the yeast then goes to replicate, it doesn't know any better. It just reads the window for hepatitis B surface antigen. So as it grows, it makes hepatitis B surface antigen. And so that is purified, quantified, and that's what goes into the vaccine. So no risk of viral infection from recombinant vaccines. But if you've been vaccinated against hepatitis B surface antigen, you will have antibodies against hepatitis B surface antigen, but you won't have antibodies against hepatitis C antigen because it's not in the vaccine. Anyway, with perinatal hepatitis B prevention, mothers are screened during pregnancy to see if they have hepatitis B surface antigen. If so, first vaccine for hepatitis B and the HBIG should be given within 12 hours of birth, and then 2 subsequent vaccines. Every once in a while, a real tiny preemie that's under 2 kilos needs to get a hepatitis B vaccine if mom's positive. But that isn't counted in the 3 doses. But in most cases, the children get just 3 doses. Every once in a while, they get combination vaccines, and so they get an extra dose of hepatitis B vaccine in there. But normally, it's just you need at least 3 doses of hepatitis B vaccine. And so 2 to 3 months after the final vaccine, giving time for moms, any of mom's antibodies to leave the infant. The infant's tested for both hepatitis B surface antigen and antibodies to hepatitis B surface antigen, because you want to see, could the child be infected? Is the child protected, or are both negative because they're not infected but not protected? So if you get that surface antigen positive in the infant, unfortunately, that means the child's been infected. If they're antibody positive, hepatitis B surface antigen, and surface antigen negative, that means they're protected. If they've got over the 10, I believe it's 10 milli international units, but they're protected. Remember the graphs I showed you? In acute hepatitis B, you have the surface antigen first, and it's not till several months later after you clear it that you get the surface antibody. And in chronic infection, when you have persistent surface antigen, you never get antibody to surface antigen. So you can't have both surface antigen positive and antibody to surface antigen positive. And notice, as we're testing with perinatal hepatitis B, we are not looking for anything besides hepatitis B surface antigen and antibody to hepatitis B surface antigen. Every once in a while, a child will turn out negative for both surface antigen and antibody, meaning they're not protected. So the easiest thing to do is just give 1 more dose and check. But, and then if they're antibody positive, that is great. If they're not yet antibody positive, then in their surface antigen negative, you just give 2 more doses and check them. If after 2 series of 3, they don't turn positive, they're felt to be a non-responder. But virtually always, this gives enough antibody for the infant to be protected. Okay, let's trying to get this forwarded. Oh, for some reason, it's not wanting to progress, so I'm going to do next. Okay, so let's go through this interpretation of maternal prenatal serology for hepatitis. So if a mother is hepatitis B surface antigen positive, that means the mother is infected with hepatitis B virus and is contagious. And then what you need to do is you need to give the child the vaccine and immune globulin within 12 hours of birth. And you'll notify the hospital of the mother being positive and the county health department so they can follow up on vaccination and serology testing, and you educate the mother, and the mother needs GI care. Sometimes more and more what they're doing is they're giving mother an antiviral for hepatitis B. So there are very low levels of hepatitis B to decrease the risk of the child getting hepatitis B. So if the mother's surface antigen comes back negative, what does that mean? That means not actively infected with hepatitis B and not contagious. And so what should he do? Baby will need the first hepatitis B vaccine within 24 hours of birth. If the mom has never had hepatitis B vaccination, we know she's surface antigen negative, then she needs to be vaccinated so that she can be protected and the baby can be protected. Future babies can be protected. Okay, so if for some reason somebody does antibody to hepatitis B surface antigen testing on a mother, there's no reason to do that unless there's a question as to whether she's been immunized in the past, if you're wanting to find out, and does she have antibodies. But for routine prenatal screening at just the hepatitis B surface antigen, but sometimes antibody is tested for. That doesn't, if it's negative, that doesn't that doesn't exclude infection with hepatitis B. Mother has no protective antibodies to hepatitis B. So what needs to be done? Mother could be infected with hepatitis B. Remember, if you're infected with hepatitis B virus, you do not develop antibodies to hepatitis B surface antigen. So all moms need testing for that surface antigen because that tells you that the mom's infected and that you need to give the child HBig and hepatitis B vaccine within 12 hours. But if the mom is surface antigen negative, then she needs a vaccine. But if she's surface antigen positive, that's when you do the gastrointestinal referral, and that's when the GI doctor will look at a hepatitis B DNA viral load and decide about whether this mother who is surface antigen positive before delivery, whether to give hepatitis B viral therapy. Okay, so now at 9 months of age, after getting the last vaccine at 6 months of age, the child is tested both for surface antigen and for antibody to hepatitis B surface antigen. And the surface antigen is positive, but the antibody to hepatitis B surface antigen is negative. So what does this mean? What's the interpretation? Infants infected with hepatitis B because it's surface antigen positive. And when you get infected with hepatitis B and you're surface antigen positive, you never develop antibodies. So recommendations, GI referral for the infant and for the parents. Well, hopefully mom would have been referred previously, and educate the parents. We don't like seeing this, but it's better to know it than not. Okay. What if the infant, after the third and final dose, develops or is tested and is found to be hepatitis B surface antigen negative and antibody to hepatitis B surface antigen positive? What's the interpretation? Not infected. And you know that because they're surface antigen negative, but they're antibody positive. protective immunity. So what you do is celebrate. This is what we want to see. Okay, another serology result. Hepatitis B surface antigen is negative, and hepatitis B antibody to surface antigen is negative. What's the interpretation? Not infected, but not protected. So what you need to do? Repeat the hepatitis B vaccine, either 1 or 3 doses, repeat, and after that, recheck antibody to hepatitis B surface antigen. And you may want to consider also hepatitis B surface antigen, but you want to see that, presumably the child's not infected, but you want to make sure that they get a protective antibody, because they're going to be going back into a family that they're people who are infected with hepatitis B. They need to have protective antibodies. Okay, so there's a big long list of people who need post-vaccination hepatitis B serologies. Most people do not. And with time, most people's serology fades, but epidemiologically, people have been protected for 20 to 30 years, even though their serology turns negative. But there are certain people that you really need to know that they're antibody positive and antigen negative. Infants born to hepatitis B surface positive mothers, and then healthcare workers, people who are going to be at risk for getting exposed to blood and body fluids, because if they're fully immunized and protected and they get exposed to blood with someone who's hepatitis B surface antigen positive, you don't have to give them the HBIC. You handle them differently. And so the same thing for looking with someone who's going to be at risk, such as sex partners of people with chronic hepatitis B, hemodialysis patients who are going to be exposed to all this blood. You need to know after their vaccination that they're seropositive, and they don't tend to respond as well to vaccinations. Immunocompromised people, including HIV-infected people, don't tend to respond as well to vaccines. So in those cases, you want to check their serology to make sure they have protective antibodies. Okay, so we've gone through the prenatal hepatitis B serology. What about people who I have listed that need to have post-serology, post-vaccination serology? Go ahead and give the 3 doses. Now there's a new vaccine, hepatitis B vaccine, that only needs 2 doses, but I'm just showing the 3 as an example. So get the full series, and then at least a month later, since you don't have to wait for any waning antibody levels from the mom, go ahead and a month later, 1 to 2 months later, get antibody to hepatitis B surface antigen. If it's positive, they're protected. If it's negative, go ahead and do the next series. You can do 1 and test, you can do 3 and test, but you are looking to make sure they seroconvert. So, a month after the final test, check the antibody levels. If they're positive, they're protected. If they're negative, they're felt to be a non-responder. But before completely labeling them as a non-responder, check for hepatitis B surface antigen. So if you have a healthcare worker, if you have somebody who could be from an area of the world where there's a lot of hepatitis B, if they're at risk for hepatitis B because of using IV drugs, you may wish to test earlier in the sequence for hepatitis B surface antigen. And I mentioned an alternate approach is that if after the first 3 doses you test negative, you can give another dose, and at that time you may want to, in addition to testing for antibodies, you could test for hepatitis B surface antigen at that time. And if they're negative, then go ahead and do 2 more doses. And then, if they're positive antibody, they're protected, a negative antibody, they're a non-responder. So let's say you have a healthcare worker that's a non-responder. Then if they get exposed to blood, especially from someone who's hepatitis B positive, but if there's blood or body fluid exposure, hepatitis B immune globulin is often recommended. Okay, so let's talk about somebody who presents in your office with jaundice. Now, of course, jaundice can be due to hepatitis A and to toxins or drugs or whatever. But let's say that this is a patient that you are looking for hepatitis B as diagnosis for the jaundice. The serology for hepatitis A is pretty straightforward, but for hepatitis B, you've got all of these tests out there that sometimes it's hard to remember exactly which test you want. Remember, you have the surface antigen that is first detected after initial infection, and then you start getting antibodies to hepatitis B core antigen. And you'll get both IgM and IgG antibodies. And you can get later on, once the surface antigen has cleared, you get the antibody to hepatitis B surface antigen. So you want to test for presence of hepatitis B surface antigen because someone's having symptoms. Probably going to be the surface antigen or antibody to hepatitis C. And I like ordering both the IgM and the total because that can tell you about acute or chronic. Because maybe they're chronically infected and not acutely infected, and there's something else causing the hepatitis. And then you can test for antibody as well, hepatitis B surface antigen, because if they don't have surface antigen, but they have antibodies, hepatitis B, they're protected and the jaundice isn't being caused by the hepatitis B. Okay, so you have to test both the surface antigen on the left, the antibodies to the surface antigen on the right, and that window area, hepatitis B core antigen, both IgM and IgG. Okay, and again, remember the progression to chronic hepatitis B. So someone can get jaundiced from hepatitis A, let's say, and yet have chronic hepatitis B. So the IgM will disappear after 4 to 6 months, but you're left with antibody, total antibody to hepatitis C being positive. And of course, the surface antigen will be positive, but you get out, if it's chronic, you won't have any IgM, no antibody to hepatitis B core. If it's acute infection, you will have both the surface antigen, total antibody, and often you'll get then that IgM. Okay, so let's look at a jaundice patient with hepatitis B serologies. So someone is surface antigen positive, and also both IgM and IgG are positive for antibody to hepatitis B core antigen, while the antibody to hepatitis B surface antigen is negative. What is the interpretation? They're acutely infected with hepatitis B. So they need the education. Whoops. They need the education. They need medical care. That's got a touchy computer here. They need medical care. They'll need testing in 6 months to see if they clear the infection. Public health will need to be notified. And just going back to education, they are presumed to be infectious until they become hepatitis B surface antigen negative. And so they really need information so they know the sexual contacts are at risk, can't share needles with anyone. They need that testing in 6 months and see if they've cleared. Okay, you have a jaundice patient who is hepatitis B surface antigen positive. Total antibody to hepatitis B core is positive, but the IgM is not positive, and there are no antibodies to hepatitis B surface antigen. So what's the interpretation? They're chronically infected with hepatitis B. Again, they've cleared the IgM, but once you're infected with hepatitis B, you are going to continue to have antibody to hepatitis B core, and you're going to continue to be surface antigen positive. And you will not develop protective antibodies to hepatitis B surface antigen. So again, education, referral to a GI specialist, notify public health. Okay. So we have a jaundice patient, and the hepatitis B surface antigen is negative. The total antibody to hepatitis B core antigen is positive. The IgM hepatitis B core antibodies are negative, but the antibody to hepatitis B surface antigen is positive. What would this mean? They are immune due to a past hepatitis B virus infection. They have cleared the virus, would have been an acute infection, so they no longer have surface antigen in their blood. They have been infected, and they're going to stay positive for the rest of their life for antibody to core antigen. But since they've cleared the infection, the IgM also goes away after 4 to 6 months. So that is negative. But once you clear the infection, after about 6 months, 6 to 8 months, you will then develop antibodies to hepatitis B surface antigen. And when I say 6 to 8 months, that's from first being infected. And it's a couple of months after you clear the surface antigen that you will then develop antibodies to surface antigen. So they're jaundiced, but they look immune due to past hepatitis B infection. And so the jaundice is not due to hepatitis B. And you don't need a vaccine because they're already positive for antibody to hepatitis B surface antigen. The infection was enough of an immune challenge, and so they're positive, and there's no need to give a vaccine. Someone who is positive and gets an extra vaccine, it's only going to hurt in terms of financial or a little poke in the arm. There should not be a safety issue there, but there's no need to vaccinate. They're already vaccinated naturally. So look elsewhere for the cause of jaundice. Okay, you've got a patient who's jaundiced, and the only result is that they are antibody positive to surface antigen. What does this mean? They're immune due to hepatitis B vaccination. Why do I say that? Because they've never been infected with hepatitis B. Why do I say that? Because they have no antibodies to core antigen. They're not infectious because their surface antigen is negative. They're not acutely infected because not only a surface antigen negative, but the IgM antibody, the core antigen, is negative. And it's not hepatitis B because they have antibodies, protective antibodies to hepatitis B. So what needs to be done? Well, since the jaundice is not due to hepatitis B, you don't need vaccination because you're positive. Serology, protective antibodies show that you're protected. You just have to look elsewhere for the cause of jaundice. Okay, we've got another presentation. Jaundice patient, and you have all 4 of the serologic tests being negative. What does this mean? They're susceptible to hepatitis B. It's not due, the jaundice is not due to hepatitis B, but they're susceptible. They do not have protective antibodies, no antibody to surface antigens. The recommendation is they need to get the hepatitis B vaccine series, but the jaundice is due to something else. And so that needs to be looked for. Okay, there are a few if, ands, or buts. If the if the total antibody to hepatitis B core antigen is positive, but the surface antigen is negative, and the antibodies to surface antigen are negative, there's 4 different interpretations that CDC lists. One is the anti-HBC could be a false positive. One could be that there's a past infection and the surface antibodies have just waned over time. One could be that there is an occult hepatitis B infection. And the final one is if it's a young infant, there could have been passive transfer from a previously infected or a currently infected mother. And so the child picked up her core antibodies. Things that you have to watch out with hepatitis B serologies, I mentioned a few. One is electronic record transcription errors. I've seen several cases where someone who had been tested previously for hepatitis B, and they were positive, and somehow that did not get put into the electronic record when they were admitted to another hospital. I mentioned the false positive surface antigen. I mentioned that, I didn't mention this. Every once in a while, after you get a hepatitis B vaccine, you can have transient positive test for surface antigen. Why? Because the vaccine is composed of surface antigen. We saw this in a 3-day-old baby. That was, for some reason, they got tested for hepatitis B, and it was positive, faintly positive, and we all scratched our heads until we figured out it was due to the vaccine. Rarely you can get false negatives to surface antigen. Rarely. It's more common getting false positives to surface antigen. If you use the E antigen or E antibody in the diagnosis, it can mess you up. I saw somebody who had a history of hepatitis in the past, and people did not ask, this was a perinatal patient, and mom had a history of hepatitis, and people did not check into the fact that it was actually hepatitis B, and there was an electronic transcription error. And I mentioned about reading laboratory result footnotes. Somebody had thought, okay, I'm going to do a DNA PCR and I'll find out. And again, it said not detected, But then the footnote said, well, there's something there, but it just does not reach the limit, the lower limit of positivity. So just remember the patterns of hepatitis B serologies. And this, remembering the pattern is the simplest way to feel very comfortable with responding to the serology. I find it's easier than memorizing a list. I memorize the pattern of how the surface antigen rises and falls with an acute infection. And then you have that window period where you only test the either IgM to core antibody, to core antigen, or the total IgG, the core, and then the surface antibody that develops, or with the chronic infection that you never develop antibodies to surface antigen. You always stay positive for surface antigen, although you do develop antibodies to core antigen. So I hope this has been helpful. And CDC does have a list of interpretation of hepatitis B serology results. And so you can read what the different results mean. And something like this is helpful. This is where I got the 4 interpretations for just an isolated antibody positive to hepatitis B core antigen. But I find using the serology is extremely helpful. And then the MMWR morbidity mortality weekly report from January 12th, 2018 also has in-depth explanation of how to test for hepatitis B and what vaccines need to be given. So I hope that this has been helpful.